Good afternoon. David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for May the 27th. Going into the numbers, we're at 98,465 cases have been reported in Shelby County during the pandemic so far. It's an increase of 97 cases that were reported yesterday. Just for information, we're averaging about 90 cases per day over the last 7 days. We had 1,671 fatal cases. Those are the deaths, and we have had an increase of 3 deaths reported in the last 24 hours. And surrounding counties, we've had 7,443 cases reported from Tipton County in Tennessee, 5,153 cases from Fayette County, Tennessee, 5,728 cases from Crittenden County in Arkansas, and 22,080 cases from DeSoto County in Mississippi. On the vaccine front, we've had 355,102 people reported yesterday afternoon vaccinated in the Tennessee Immunization Registry, and that includes 84,805 who are partway through their 2-shot series and 270,297 people who are fully vaccinated. And we did have an interesting discovery over the past week. We had an outbreak in one of our nursing homes or long-term care facilities, but it was an extraordinarily mild outbreak. We had a number of individuals who were the heavily vaccinated population in the nursing home. They did test positive and are technically counted as cases, but most of them had no symptoms whatsoever, and the couple that had symptoms were very, very mild. So that's an evidence that the vaccine is working to protect our most vulnerable population. Those folks had the virus introduced into the facility accidentally from the outside world, and yet the people who lived there really suffered no ill or adverse consequences because they were vaccinated. And that's what we're wanting to emphasize to folks throughout the community. I mean, right now, the population that has the highest case rates per 100,000 are young folks 18 to 24 years old. And in the analysis that was done this week, looking at the biggest age group that had COVID diagnosed in the last week or last 2 weeks have been our kids. The pediatric cases represented 24% of cases. So those folks younger than 18. So it's wonderful that we've gotten over half our population in Shelby County, that's 45 years old and older, vaccinated. In our 65 to 74-year-old population, we're at 75% are vaccinated. 75% of people in that age range are vaccinated. But right now, only about 5,100 or 10% of our eligible children have been vaccinated, and those age groups less than or lower than 45 years of age, they're less than half are vaccinated, and that's where we see most of the transmission going on. More than half of our cases are less than 35 years old over the last 14 days. So we still want to encourage people to come out, particularly our younger folks who are less vaccinated, to come out and become vaccinated and help us continue to push down the numbers and reduce the transmission of this virus in our community. For more information about the progress on the campaign, I invite Doug McGowen to the podium.
Thank you, David. Really appreciate all the good information, and just to follow up on what David said, we have done about 625,000 vaccines here in Shelby County. That's about 40,000 more than any other county has done, but as a percentage, we are the largest county in the state, so we're just slightly behind in our percentage. So we're hopeful that people will come out and raise our percentage so that we are much, much closer to that herd immunity. And I wanted to talk today a little bit about why vaccinations are important, how we're getting the word out to people, and how we might help people get vaccinated, as well as some changes in the operation. So first, why vaccinations are important. I think what David just mentioned, it highlights the critical importance of people who are vulnerable and susceptible to the virus getting vaccinated, because that outbreak at the nursing home in a heavily vaccinated population resulted in no adverse effects. Similarly, the deaths that we have suffered here in our community, almost, I think, 1,700 people have died from COVID, nearly 90 people in just the last 2 months. But one of the things that the doctors tell us is that no one who has been fully vaccinated has been counted among those deaths. So we don't have anybody that we know that has been fully vaccinated that has died. And so that is a pretty compelling evidence for us to make sure that people get vaccinated, because any death is too many, and 1,700 is certainly too many. And the 90 people who've passed in just the past 2 months is certainly way too many. So the vaccine works. If you get it and you happen to become exposed and you're vulnerable, you don't get sick. You are very likely not to pass away from COVID if you are fully vaccinated. Getting that word out to people is important. That's something that we've talked about. So we've had a lot of public vaccination sites. We've had a lot of public messaging. But as we've talked about, we have to get our ground game on. And that means person to person, door to door, sharing information with people who may be hesitant. And that's exactly what we're doing. You've heard Mayor Harris talk about the collaboration and the community effort that we have underway. I'll give a couple of examples of what our ground game looks like that we've just deployed starting last week and moving into this coming week. We have a team called Our Best Shot Field Team. They are going door to door in the 5 zip codes that have the lowest uptake and letting people know about their opportunity to get a COVID vaccine and where they might be able to take advantage of that and why it's important to get that COVID vaccine. There are students in those teams from Rhodes College. They started on Tuesday of this week. Today they're in 38106 and 38126. As of yesterday, they had knocked on more than 200 doors, sharing information with people about why it's important. We also have a street team that is going into commercial businesses where people gather and where we might have an audience to share information about vaccines. That is ongoing as well. But just like a political campaign, we also have a phone bank through a partnership with the University of Memphis and UMRF Ventures, which is an agency that employs University of Memphis students full-time. They have a phone bank and access to phone numbers to call people and inquire about their interest in getting a vaccine, providing some education, and essentially getting the word out about why it's important to get vaccinated. And then finally, we are also working with many of the school districts all across the county to try to host school-based pods for students who are ages 12 and above. Whether or not school is in session, schools are a place that people feel they're used to going to, and it's a trusted location, so we're trying to set some pods up in conjunction with the schools to get those 12 and up vaccinated. We continue to try to help people get vaccinated who have special needs. So I'll emphasize again, if you or someone you know are homebound, if you go to covid19.memphistn.gov, there is a link there, and you can click that link and we will come to your home and provide you a vaccination. If you don't have access to the web, you can call 222-SHOT, and they will also connect you to a homebound vaccination appointment, either through the city of Memphis or through our partners at Maritan or any of the private providers who are doing a homebound vaccination. Next week, we are launching a new program, which are Rides to Vaccine. Our partners at MATA have been providing rides through MATA Plus as well as our fixed route bus. And they are taking you to our public vaccination sites. Next week, we'll introduce a new service, and that's going to be through 901 Ride Choice. That is a service that is funded by an organization called LISC. We'll put an announcement out about what day it starts next week. But if you dial 901 Ride 901 and tell the individuals there that you need a ride to a vaccine, they will take you to the place that is closest to you to get a vaccine, where you will get out of the car, go in, get vaccinated, get back in the car, and they will take you back home. So again, it's Rides to Vaccine through 901 Ride Choice. The number is 901 Ride 901, and that starts next week. This weekend, on Saturday at the Pipkin Building from 9 a.m. to 1 p.m. is Tiger Day. It's Tiger Vaccination Day at the Pipkin. And as you know, we're doing a car giveaway, but to sweeten the pot, if you're one of the first 1,000 people that gets vaccinated this Saturday, you're going to get 2 tickets to the Tigers versus Nicholls State at their home opener on September 4th. So if the car wasn't enough, getting to see our Memphis Tigers in action against Nicholls State on September 4th, come on out on Saturday morning and get your vaccine, get a couple of tickets to the Tigers home game, and enter to win a car, which closes out this weekend. So through May 31st is your chance to enter. Anyone who's been vaccinated to this point can go on the website and enter to win the car. So this is your last weekend. Come on out and get either your last dose or your first dose, and you can be entered to win that car. A couple of notes on changing operations. Our fixed sites, we're seeing fewer and fewer people come to the drive-through sites. So as I said, we're moving to a ground game with community-based pods, school-based pods, and actually homebound vaccination, and also taking people on through rides to the various commercial providers. At the end of this month, so May 29th, the site that's at Greater Amani in Raleigh will be closing down, as will the site at the Gill campus of Southwest Tennessee College. That their final day of vaccinations is actually today. But as I said, we are ramping up our ground game. The city of Memphis had, as you know, a vaccine machine. That's what we call it, the vaccine machine. We've actually acquired a second vaccine machine. Those can go out and be accessed by people at community-based pods. And there is a spot on our the covid19.memphistn.gov website where you can request a community-based pod. You'll see the paramedics out there along with some support staff providing vaccines at those community-based pods. So the last change is that this event that we've been hosting twice per week, given the numbers and where we are, we'll be moving to 1 press briefing per week, and that will be hosted each and every Thursday at noon. Starting next week, there will be no press briefing on Tuesday. We'll only be doing it once a week at noon at this same location. So with that, I'll pause and take any questions that people may have.
Mandy Rock, Fox 13.
Hey, good afternoon. I was wondering if you could give an update on how many breakthrough cases we're seeing in the county, and if those cases at the nursing home would be considered breakthrough cases, since you said most of the people were vaccinated.
Sure. I'll let David answer that.
Yes. Yes, I mean, if they're fully vaccinated, they would count. And if they're not fully vaccinated, they wouldn't count as a breakthrough case. So there's a case definition for what is a breakthrough case. That's a fully vaccinated individual who develops COVID more than 2 weeks after their second dose. So it would be somebody who's fully vaccinated, has been more than 2 weeks since their second dose, and then they still get COVID, then they would be counted as a breakthrough case. We've had 64 such instances since last December. Considering that we've had 355,000 plus people vaccinated, that's a minuscule percentage, but it is something that we do capture in the system when it occurs. So yes, in that instance of the nursing home or the long-term care facility, if they were more than 2 weeks out from their last dose, then yes, they would get counted in that total, yes.
Okay, thank you. And my second question is just an update about the car sweepstakes. Do you have numbers on how many people who have applied for that at this point?
I don't have the most recent numbers. I know it was in the 30 or 40,000 as of last week that had entered into the sweepstakes. And I'll just remind everybody, you're not automatically entered into the sweepstakes. You need to actually go onto the website and register yourself. You don't have to prove that you've been vaccinated to register, but if you were selected to win, that's when you have to prove you're vaccinated. And it's either your first shot or fully vaccinated. Either one is eligible. And whether you got vaccinated back in December or you get vaccinated this weekend, you're eligible to enter.
Omir Yusuf, Daily Memphian.
Hello, this question is for Doug. What made this the right time to wrap up the vaccination sites in Raleigh and Fraser specifically? And I have a follow-up.
Sure. Just the rate at which we have seen people come, so they're fully staffed with a robust staff of 12 to 15 vaccinators, sometimes 10 vaccinators depending on the day. But the utilization has been really, really low and diminishing. And so what we're choosing to do is to redeploy those assets. Again, those are low areas of low uptake, but to put more efforts into more community pods with trusted agencies in the community, through the schools, through churches, and through other agencies that may want to do a pop-up pod, as well as those mobile operations. So it's really just shifting away from the drive-through sites where we are seeing every day a diminishing level of return, and instead pivoting to a place where it's we believe that there's a better probability that people will take up that vaccine.
And I know you said that you all are ramping up your ground game now. What are a few things that you all have noticed that have really worked so far? And what would you want to, I guess, build upon those things, I guess, in future weeks?
So I think that the ground game so far is just getting out there and getting to people who, no matter what you do, and you think you have a wonderful communications through social media, through television, through the paper, through the radio, there are some people that are just not going to get the word. And I believe that that's why, just like in any campaign, whether it's for a referendum or whether it's for political, kind of an election, there's always some door knocking that happens, and that's just a proven recipe for success to get word out to people about what you're trying to get them to take advantage of. So we think that is a proven track record of success in other venues, so we're hopeful that we'll get there also in this vaccine campaign. Phone banking is also something that we believe is effective to reaching people who don't otherwise get information, but we're really trying to leave no stone unturned. And we will continue with that in the next few weeks. And look, we fully understand that this is a phenomenon that's happening across the country. Many people are going to rely on their doctor giving them that word, so we think there are people going to their healthcare providers to give them that advice to get vaccinated. There is plenty of opportunity for vaccine, and it's all free. As I said multiple times, there are more than 100 private partners who can deliver that. And if you're more comfortable going to your local Walgreens or Kroger to get a vaccine, we encourage you to do so. Your local pharmacy or local medical clinic, we encourage people to do so. The mass public vaccination sites are seeing diminishing returns. We will keep several of them open through the month of June, and we will keep, Pipkin, we don't plan on shutting that down anytime soon. So we will always have at least one mass vaccination site for the foreseeable future. And we, as we have said, we have opportunities to give people rides to that location. Your follow-up?
Oh, that was a follow-up. Kelly Roberts, WMC.
Good afternoon. I think both of these questions will be for David. Going back to the nursing home outbreak, where you said symptoms were very mild in those patients, we have recently gotten some information from the Mississippi Department of Health that they've had some outbreaks in long-term care facilities involving certain variants, for example, the South African variant. In this particular outbreak, did we see any variants that we haven't seen a lot of in Shelby County, or is it that Wuhan or the B117, which I know is starting to make up most of the cases?
Yeah, no, it was actually the B117, the dominant virus that's circulating in Shelby County, and that's one that is protected for, the vaccine protects against that strain. And this is an important thing to remember about what is it that we should expect the vaccine will accomplish. So we should expect the vaccine will protect people against dying, that it will protect people against getting severe disease that requires hospitalization, and it can protect people from getting infected at all. Or if they get infected, it would get it out of their immune system, or their immune system would fight off, and there would be no illness. But for the most frail, the most immunocompromised, so if you're a person with an organ transplant, or a disease like HIV disease, or you have cancer and you're receiving chemotherapy and radiation therapy, any number of reasons people may have a compromised immune system. Well, the vaccine is going to help your body fight off the virus if you get infected, but with a compromised immune system, the immune system can't do as much. And so you may still get sick, but the illnesses will be milder and less severe, and the hope is that they would also protect even those individuals against death. But it is a vaccine, and the vaccine is charging up your immune system. If your immune system is already compromised, you may still get sick. I mean, you see that's the point. But the illness would not be as severe as if you encountered the virus with no protection at all.
Thank you. And my second question is, we're 12 days, I guess, since the implementation of the last health directive. I know that we've seen some promising statistics for the trajectory of the local pandemic, being the reproduction rate has fallen below 1. And I know earlier this week, our average daily case counts were averaging well under 100. Now that we are almost 2 weeks since implementing the most widespread loosening of these restrictions, is this one of the best kind of outcomes we could have seen? As I know, a lot of eyes were kind of on what would happen as these restrictions were so widely loosened.
Right, and so thank you for the question. We are certainly not seeing yet any sort of evidence in our data streams that things have worsened. They've actually continued to stay on the path that they were already on of declining cases. And our reproductive rate of the virus today is 0.83. So that means each case is creating 0.83 new cases. And we're shrinking the future epidemic at this point in time. Now, it's at this point in time. If we get a different strain move into the area the vaccine doesn't protect against, or we get some other reason that the epidemic could regain energy, then it is always possible that case numbers could rise again. And in other parts of the world, we've seen that. Some countries that seem to have COVID basically under control then suddenly get a new surge. Usually that means that there's some sort of change in the virus and that people are more susceptible to that varied virus. But that's why we do the sequencing, and we're not seeing any evidence right now of a new virus in our community that evades the vaccine right now. And so, so far so good.
Hannah Gravenstein, MLK 50.
Hi, David, while you're up there, could you just give some numbers on this nursing home outbreak? How many people were asymptomatic? How many people were mild? How many were, residents? How many were staff? Just some data.
Yeah, we have one staff person and 12 residents, and I believe 10 people had no symptoms whatsoever.
Cool, thanks. And then I guess my next question is for Doug. In terms of the ground campaign the city is running, what kind of coordination is there with the county? I know that the county was also doing door knocking. Is there any, are you trying to not hit up the same houses or the same zip codes, or what's going on there?
Yes, exactly. So our teams are coordinating. This has been a joint task force, a coordinated effort from the beginning. So we're just trying to add to what's happening, not compete with or anything else. This is all done in coordination. So our communications teams are working together to make sure that we're not hitting the same houses at the same time and that we get the maximum amount of impact. So I was just adding information this morning that we're adding some additional resources to the ground game, the phone banking plus some other best shot team that's out there working in some of the zip codes. So absolutely coordinated.
April Thompson, WREG. April, I believe you're self-muted.
Can you hear me now?
Yes.
Yes.
Okay. I just had a question about this is the unofficial start of summer. Camps are going to be coming back and pools. What is the safety for people opening pools and kids, adults swimming in pools when it comes to the virus? I have a follow-up.
Are you speaking about the public pools or just like their backyard pools, that kind of thing?
The public pools, like the city pools.
Sure, yeah, we're gonna follow all the guidance that we have there, and everything's gonna be, obviously sanitized, and then there'll be limits on how many people can be actually in the pool, but that's one of the things that our Parks Director has been working with Dr. Randolph on. I don't have the specific restrictions there, but we are making all the pools ready for use this summer because we know they're gonna be in demand. We have opened the portal for summer camps for our children, and so we have thousands of applications already for that, so we're also following the CDC guidelines and the local health directive on the numbers of kids that we're allowed to have at any one of those facilities at any one time. I apologize, I don't have them off the top of mind here, but I can probably get those restrictions to you. David, did you have anything that you wanted to add to that?
Just briefly.
Okay, sure.
So, I mean, just to remember, as I said earlier, in the last 14 days, 281 or 248 children have been diagnosed with COVID, and that's 24% of all the cases that have been diagnosed. So even though we may be talking about summer camp or any other activities, if as a parent or guardian, you know that your child has some sort of illness, some sort of symptoms of illness, it's really important to keep them home and not to send them out into the world to interact with other folks. So similar in the workplace for adults. If we are sick, we need to still stay home. Don't go to work. Don't share your virus with the community. That remains to be sound advice. And we do still, even without the mask, even outdoors, need to practice reasonable social distancing from over congregating, because we are still getting 90 people a day diagnosed in Shelby County and reported per day with COVID disease. So the COVID pandemic isn't over. The virus is still here and still spreading. It's at lower levels, but it's still spreading, and we still have people who are vulnerable and susceptible to the virus. So for all of us, if anybody's experiencing signs and symptoms of COVID infection, the appropriate thing to do is isolate at home for 10 days or 7 days, depending what the viral testing shows. And then for contacts of people you've been exposed, to quarantine. That's still a recommendation that remains in place.
But there's no greater risk in a pool and pool water.
No, it's not.
Interaction.
No, it's a respiratory virus, so it's in the air. It transmits through the air, and so swimming is not, and it doesn't do anything to increase somebody's risk. And outdoor activities are safer than indoor activities anyway.
Was there another follow-up, April, or?
Did Doug know when the city pools are going to be open?
Well, I'm striking out on all fronts today, but yes, I think it's, we plan to open them after schools get out, so I believe that it's a little bit of a shortened season. I'll get you the exact date, but I do know it's either late in June or beginning of July. And I'll get that date back to you. I apologize for not having it top of mind.
Those are all of our questions today. Are there any closing messages?
Vaccinations work. David gave you the data about our most vulnerable population having a small outbreak, but having no adverse consequences. And so that's why it's important. And again, as I mentioned, doctors don't know of anybody here who's been fully vaccinated that has been among those people who've passed away. So we still have plenty of availability. We encourage folks to get out there so that you can feel safe and comfortable and not worry about the impacts from COVID. I think David's words are wise. The pandemic is not over. We have to do all we can to stem the spread. It's been a few weeks since we've mentioned if you believe you're suffering seasonal allergies, let's not assume that it's seasonal allergies. We still have plenty of opportunity for you to go get tested too. Let's rule that out before you decide to go out into public, before you decide to go to your place of work or send your kids to camp we're off to school, since schools are still in session in some districts for a while. Let's not make any assumptions. Let's not forget the things that got us to this point of a low transmission rate, a low R0 reproductive rate, and a low number of daily cases, which are still far too many. So I appreciate the opportunity to be here today. Again, we will see you next Thursday for another update for our now once a week press briefings. And obviously, should things change substantially, we'll go back to more recent or more frequent briefings. So thank you all. Have a good and safe Memorial Day weekend. This is something we're going to all have to pay attention to. It's not a free-for-all, so do the right thing when you're gathering together with friends and family. Use that as an opportunity to encourage them to get vaccinated and to help us all in the cause. And we look forward to seeing everybody back safe and sound next week.
Thanks, everyone.